Hi everybody, it's Helen Birch here. I'm a sex therapist, clinical hypnotherapist and sexual freedom practitioner. Today's video is just going to be discussing some sexual dysfunctions that affect males. In the past, it was believed that elderly males were the only ones who experienced erectile dysfunction and that the little blue pill was the only solution. That little blue pill obviously is better known as Viagra. However, erectile dysfunction in those under 40 has dramatically increased in recent years. It has become such a problem that the phrase millennial ED was even created by the medical community to identify this problem. The problem with using Viagra and other such pills is that it can have a number of negative physical side effects. These can include headaches and high blood pressure. Additionally, having to take the pill means that you must always schedule in your sex sessions, and this is because it takes between 30 and 60 minutes to begin to work. Sadly, our minds can still overrule the use of Viagra and can prevent it from working. So Viagra is not 100% effective and is not the best solution for curing erectile dysfunction. When you are with a sexual partner, some men also find it difficult to become hard, while others get hard but then lose their erection, which may or may not return during sex. This is called erectile dysfunction. There are several common reasons for erectile dysfunction, and these include general performance anxiety, dependence on porn, previous damaging sexual experiences, challenges with confidence or low self-esteem, certain side effects of prescription medication, and erectile dysfunction, which is induced by use of condoms. This is where you are losing your erection when you put on a condom. It is important to know that if you can maintain an erection while masturbating, whether with or without porn, then the problem is probably in your mind. And this is where things such as hypnotherapy and sex therapy can help. However, if you can't, it's probably a physiological problem. So I do recommend seeing your doctor. In fact, it's not a bad idea to do so either way and just check that all systems are working okay to begin with. So what is the possible treatments for erectile dysfunction? Sexual stimulation should be typically followed by a response such as erection. But for whatever reason, it takes just one or two failed tries at maintaining an erection for your erection to continue to go. The stimulus here could be excessive thoughts or worries, which then trigger a reaction. The mind then dwells on it, which has little or no effect on our ability to keep an erection or maintain an erection. Through my sessions, I employ a combination of hypnosis to ease any anxieties, the use of behavioural conditioning, psychoeducation, explaining what's happening for you and why, and simple homework tasks. This happens over the course of typically 6 sessions, and all this together will significantly improve your situation and help you get back on track. So the next problem I'm going to talk about is premature ejaculation. 1 in 3 men suffer from premature ejaculation, though most never talk about it and instead they just settle for quick, often awkward sex. A man's confidence may be impacted by premature ejaculation, which may cause him to avoid sex or give justifications for how long it took. Most males, however, either act as if there is no problem or feel embarrassed and uncomfortable and refuse to talk about the situation. There are many justifications and explanations offered by males who ejaculate too soon. These can include things such as you really turn me on, or I prefer it hard and fast. However, this is not the underlying cause of premature ejaculation, which results from a lack of control over one's body rather than from sexual preferences or excitement. There are two varieties of premature and early ejaculation. Primary premature ejaculation, which has been an ongoing issue throughout your whole sexual life, and secondary premature ejaculation, where the issue has just recently manifested itself. Primary premature ejaculation is frequently caused by psychological factors such as early sexual trauma and experiences. Both psychological and physical reasons may lead to secondary premature ejaculation. The overuse of alcohol and prostate gland inflammation are some examples of physical causes. However, being able to orgasm fast has been advantageous for males throughout evolution. In fact, some suggest that it is the male default state. This is because if you are a predator and your prey is less likely to be eaten, it made logical sense to orgasm fast and then move on to maintain your survival. Therefore, it's not your fault, and trying to hang on for a long time may actually go against your natural instincts. However, you can train your body to gain control by doing so. You want to reach a point where you have enough control to enjoy having sex carefree and to leave your partner feeling satisfied. Given this, it's hardly shocking that so many men do orgasm so quickly. However, it's no different than learning any other ability, and to learn how you want to regulate your orgasms is a very simple task. For want of a better phrase, I would say that practice makes perfect. So how does this work in hypnosis? In hypnosis, it can explain a variety of ways that will offer you greater control over your orgasms, and then it will help you master the new skill more quickly. The next issue I want to discuss is delayed or no ejaculation. And this is an issue that I am seeing with clients more and more often. Men who are really struggling to orgasm. They either struggle with it or they cannot orgasm at all. Male orgasmic dysfunction or delayed ejaculation can be categorized as either when the man wants to and his erection is normal, but he experiences a substantial delay before ejaculation, or is completely unable to do so. You may have delayed ejaculation if you experience a repeated and unwanted delay before ejaculation lasting for 30 to 60 minutes, and you're unable to ejaculate at least half the times that you have sex or masturbate. Delay in ejaculation can be brought on by psychological as well as physical and physiological factors, very similar to the premature ejaculation mentioned above. Similar psychological factors that may contribute to delayed ejaculation include early sexual trauma, a rigid upbringing, interpersonal issues, stress, and depression. Among the physical reasons for a delayed ejaculation are having medical conditions such as diabetes, usually only type 1 diabetes, having some kind of spinal cord damage, having age-related issues such as multiple sclerosis, surgery on the prostate or the bladder. Delay in ejaculation is also a recognised side effect of numerous medications, including antidepressants, especially selective serotonin uptake inhibitors, SSRIs, blood pressure medications like beta blockers, antipsychotics, which are used to treat psychotic episodes, muscle relaxants, which are frequently used to treat multiple sclerosis and motor neurons disease, and things such as potent painkillers, for example, something like tramadol. Delayed ejaculation may have never been an issue for a male before, or it may start happening suddenly after being trouble-free for some time. Delayed ejaculation might happen in any sexual circumstance or in particular certain ones. When masturbating, for instance, you could be able to ejaculate properly, but not when having intercourse with a partner. When ejaculation only occurs in certain situations, this suggests that there is usually a psychological cause. One of the following two factors usually accounts for this, and this tends to be what I see as a sex therapist. Porn is typically when someone can quickly switch between scenes, gradual desensitization of your penis. Our conscious mind programs our subconscious mind, which is the most potent portion of the brain. When you watch something like porn and then you jump around from scene to scene, your subconscious starts to believe that what makes you want to have lots of sex with lots of people in a hurry. Our subconscious becomes confused, and it's challenging to drive ourselves to the brink of exhaustion when we only have one person in front of us who doesn't change or doesn't look different every 30 seconds, typically like you might switch through scenes if you were watching porn. Additionally, rubbing your penis repeatedly for 20 years, often more than once a day, can also cause desensitization. You cannot possibly have as much sensation in that area if it is something that you continuously rub day after day, hour after hour, and it begins to start to lose the feeling, making it less sensitive to sexual stimulation and real sexual situations. So, what is the treatment for the overuse of porn? Psychoeducation, behavioural programming, and hypnosis can be used to retrain the subconscious to seek out those things that truly excite you, to at least assist in realising that the thing or the person in real life that is in front of you is what matters and what sexually excites you. However, since our responses to sex are largely influenced by our minds, it's possible to use hypnosis to make sure that that side of your mind is truly on board. The next issue that I want to discuss is low libido. So many of my clients come to me saying that they feel they should be having a lot of sex, but they are truly not interested. Alternatively, people may feel that they used to crave sex constantly, but are now simply not in the mood. These problems can make us feel low or even depressed, whether they are with a spouse or just us in general. Although everyone's sexual desire is unique and ever-changing, it may be perplexing if it's noticeably declining, whether you're single or in a relationship. Examining the possible causes of your libido slump and learning how to revive your desire for sex with the help of these recommendations. We are continuously inundated and psychologically drained due to the increase of work commitments, social pressure, and the urge to follow the newest fads, TV shows, or self-care practices. But how is this actually hurting our sexual lives? A person's libido is complex. It varies on a daily, weekly, and even monthly basis. Various environmental factors and interactions, including stress, medicines, sleep, self-worth, and medication, all have an impact on our sexual desire. There are several reasons that can lead to low libido. These can include low testosterone, for example, lack of vitamin D, weight issues, medication, depression, and lack of exercise, plus many others. Social comparisons, the use of dating apps, social media, and TV give the impression that everyone is having loads and loads of sex. Additionally, unrealistic expectations. For example, when you were 20 years old, you might have wanted lots of sex. But at 40 years old, perhaps you think that you do, but you've actually had a fair amount of it over the years and might want to do something else. And then this leaves us feeling at odds with ourselves, with our sexual desire and what we believe we should be feeling. Confidence and self-esteem issues are also factors for low libido. This is because you get validation through sex, which can lead to disappointments if you feel you're not having or wanting sex. The feeling of pressure, worry, or anxiety about whether you're going to be able to get an erection can actually interfere with your sexual responsiveness as well. As far as your body is concerned, if you're anxious, there is a sign that there could be a real physical danger around you or a time of emergency. All bodily functions that are not used for immediate survival, like digestion and sex drive, are then put on hold. Unfortunately, just a few experiences of feeling anxious and not getting an erection can turn into a repeating pattern in your mind. In your mind, sex becomes associated with pressure and anxiety, which in turn keeps interfering with your sexual responsiveness. It then becomes a vicious cycle. It is this type of performance anxiety that hypnosis is excellent at treating, as an erection is a spontaneous, unconscious response, and it is not something that you can consciously control. Just a little bit more about sexual performance anxiety. Nearly all men feel a little anxious around sex occasionally. Sex can be a very important part of a relationship and an important part of your own identity. So it's understandable that people sometimes put pressure on themselves around sex. What's more, many men have unrealistic expectations of themselves and believe that sex is associated with being a man. When sex is portrayed in films and on TV shows, the implicit message is that to be a real man, you need to have some sort of constant, hard erection, able to maintain sex for hours and hours on end, regardless of the state of the relationship or the sexual experiences and skills of the other person. This gives the cultural belief that a man is only a man when they are successful during sex. Both men and women have doubts, insecurities, and emotional needs, and the sex works best when all partners feel comfortable and at ease with each other. One thing that can be helpful to overcome anxiety around sex is to talk things through with your partner or partners so that you both give each other permission to go slowly and allow what will happen to happen. This takes away the sense of pressure to perform. The sexual performance anxiety can also become a conditioned automatic response pattern where you come to associate any form of sexual intimacy or feelings with feelings of tension, discomfort, and pressure. So thank you very much for watching. I hope you found it useful. I shall leave some links in the box below if you want some more information. But if not, bye for me for now. Take care. Bye.